So,
Thank you, Mr. McGuire. We'll go now to Mr. Kellaway. Sorry, Mr. Van Bynen. Mr. Van Bynen, please go ahead. 6 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses who have taken the time to share their perspectives and to help inform this committee on the collateral impact of COVID. My question is for Ms. Bizans. Hi, Christina. It's always good to hear from you, and thank you for being here today and for the work that you do to support seniors and caregivers in York Region and in Simcoe County. I've seen the positive impact of your important work over almost 10 years that we work together in the Newmarket Council, and I appreciate your hard work in recruiting and engaging so many volunteers and your efforts to raise critical funding that you need to serve your community, like so many of the other nonprofits. You support a broad and diverse community, and firstly, I'd appreciate hearing on how the COVID-19 has impacted the way you serve your clients and how you've adapted to continue your support.
Thank you very much, MP Van Bynen. Well, I think that the key change or impact that has occurred on our services has been the need to move to virtual programming as opposed to in-person programming. And not unlike many other home and community support agencies, we pivoted very quickly to look at ways in which we could deliver social connectivity, but using virtual means. By that, I'm referring to both telephone as well as internet communication and programming. We also developed a number of activity packages that we developed through our adult day programs and dropped off in a contactless way to many of our clients so that they had activities that would engage them in things like crossword puzzles, recipes, things that they really could use to make them feel connected, even though they were required to be physically isolated and sheltering at home. But I think the biggest thing is that shift to virtual programming that we don't anticipate is going to go away anytime soon. And even when whatever the date is that the pandemic is declared over, we know that our clients are going to continue to have hesitancy and fear about going out and being in larger groups again. So we anticipate that the need to continue to provide virtual programs and support our clients to do so through providing them with tablets and providing them with internet connectivity, providing them with technical support is going to become even more important. Because that's not something that typically a lot of older adults would have had access to or be comfortable using. And I can report that the response to our virtual programs has been overwhelming. I mean, it still doesn't replace the in-person contact, but it has been very, very well received because it is a lifeline that people are able to know that they can connect on a daily basis or a couple of times a week, can access physical activity through, we do yoga and other physical activity exercises for them so that they know they've got that to look forward in that connection.
Thank you. Now, how many volunteers do you have to deliver the service?
Well, before COVID, we had close to 500 volunteers, and they truly are the heart and soul of the organization because we wouldn't be able to deliver near the breadth of the services that we do without them. Unfortunately, and particularly in the first wave of COVID, you'll recall that anyone over the age of 70 was advised to shelter at home and not go out. Our clients tend to skew to retired people in that age group. So unfortunately, we had to ask a number of our volunteers just to hold off until it was safe for them to be able to become involved again.
Thank you. Now, the Standards Council of Canada, the Health Standards Organization, and the CSA Group announced the launch of their process to create a new national long-term care standards. The new national standards will take into account lessons learned from COVID-19. We've heard a lot of that from you already. But based on your extensive experience in working with seniors, what would you recommend would be important considerations for this group to explore?
So let me say this, if I may. I think the time has come, and the experience from COVID and the tragic situation that affected so many frail elderly in long-term care homes has really highlighted, certainly for our organization, that it's time for us to stop questioning why people need to go into long-term care, and instead focusing on how can we help them to stay at home in their own homes where they want to be. And without doubt, there is a need for long-term care for very complex needs and conditions. But we also believe that with better investment in home and community supports, that it is quite possible and quite feasible and better for people to be able to age in place and to have the choice to do so, instead of solely investing in the creation of more institutionalized care. We need to start talking about how we enable people to be able to exercise their choice to stay at home as long as possible.
Now, if the federal government leads to a process to set out long-term care standards, how might those standards help to strengthen the home and the community sector?
I think it needs to be seen as an and situation. So long-term care, but long-term care needs to include consideration of home and community supports as well. So it's not an either or option, but an and. And I think that looking at those standards and looking at a way in which there could be better integration between long-term care and home and community supports. And by that, I mean not just assuming by default that when somebody ages and has complex care needs or advanced dementia, that long-term care facilities are the default, but looking at how there could potentially be a way to support through both sectors those individuals who need the enhanced care, but can still be involved and connected to their communities.
Thank you.